Hello and welcome to another webinar series from the Olive Wellness Institute. We appreciate you taking the time from your busy day to learn more about the health benefits of extra virgin olive oil and its use in fertility and pregnancy. Just going to go over a few housekeeping points. So after the presentation from Melanie, we'll have a short question and answer session. So please feel free throughout the presentation to write any questions you may have in the comment box at the bottom left-hand corner. We will endeavour to get as many questions as possible answered, but of course, as time is limited, we may not get to all of them. But we will make sure that we send out a copy of all the questions that you have and answers in the coming weeks after the webinar. At the end of the webinar, so after the questions, I will pop up a small survey, and we would really appreciate if you could take the time to complete. It's very short, only 5 questions. It will just help us to improve and continue these education opportunities and gives us ideas on what you as healthcare professionals would like more information on. I'm just going to introduce Melanie. So Melanie McGrice is a fertility and prenatal dietitian. She runs online programs on prenatal nutrition for mothers-to-be. The Nourish with Melanie YouTube channel is the founder of Nutrition Plus Women's Nutrition Clinics, which provides specialist fertility and prenatal nutrition support around Australia, and is an ambassador for Compassion's Mums and Bubs Nutrition Clinics, with the Nutrition Plus team sponsoring one in Tanzania. And of course, her areas of interest are reproductive conditions, fertility, and prenatal nutrition. So just before I pass over to Melanie, I just want to pop up a quick, there's going to be 2 polls. These just help Melanie quickly see who her audience is and their experience. So if you could just quickly complete the one we're popping up first is called experience. Great, thank you so much. And just the second one is going to pop up now. Great, thank you so much for completing that. And Melanie, I will now pass over to you.
Fantastic, thank you so much. Great to have you here, everyone. So thanks for joining us today. Now, I believe that my video has disappeared and we've just got slides now. So yeah, today I'm going to be speaking about the benefits of extra virgin olive oil for couples who are trying to conceive. So first of all, I think it's really important to note that nutrition has a significant impact on fertility. To get pregnant, a couple obviously needs, first of all, a healthy egg, and that needs to be combined with a healthy sperm, which is then implanted inside of a woman's uterus. So it sounds pretty simple, and it is for many women, but unfortunately it's not that simple for all couples. Now, one of the reasons why I'm so passionate about the impact of nutrition on fertility is that it has a huge role. So first of all, if we break it down into those little parts, so nutrition can have an impact on the health of the egg, first of all. But we have to remember that the egg is actually the genetic material as well as the sperm. So nutrition has an impact on the health of the egg and the health of the sperm. And the egg and sperm are the genetic material that is going to go on to make the baby. So we want to be utilising this amazing opportunity, this amazing time in the lead up to conception to really help men and women optimise their diet so that they're really setting up the health of their next generation. Then we also know that nutrition can impact the production of fertility hormones. And so that then goes on to have an impact on menstrual cyclicity, so how regularly women's periods are and how regularly they're actually ovulating. And that's important for some women who aren't ovulating regularly, and then that can be the reason why they can't have a baby. Nutrition can also have a big impact on the health of the uterus, which then goes on to impact whether that embryo is actually going to be able to implant into the uterus or not, and therefore to actually create that pregnancy. And then it also goes on to have a big impact on the growth and development of the fetus and whether or not the baby is likely to miscarry. So we can see that nutrition has a huge impact when it comes to fertility and pregnancy. So I've developed what I call the 4 stages of support for preconception nutrition intervention. And I believe that this really summarises the times when we as clinicians might need to get involved in terms of nutrition. So first of all, we have our clients who are just starting trying to conceive. And they're usually feeling pretty happy and excited, but maybe also a little bit shaky. They're a little bit nervous about what they need to do and you know, how to conceive and what this is going to mean for their lives, what it's going to mean for their finances, and everything from the type of car that they buy to their house. And so, you know, it's obviously a very big change in life. Often nutrition doesn't come to mind, although pretty much in every blog that you read about trying to conceive, or you know, you go and see your doctor or pharmacist and they'll say to have a healthy diet. But then the question becomes, well, what is a healthy fertility diet? This is really important because the impact of nutrition at this stage when couples are just trying to conceive can help to shape the baby's future. And what I'm going to do in a minute is actually go through each of these 4 stages in a little bit more detail. So my second stage is couples who, one of which may have some type of dietary condition. So that might be something like type 1 diabetes or celiac disease or endometriosis, polycystic ovarian syndrome, some type of gastrointestinal surgery, etc., etc. And couples in this situation might be feeling a little bit sensitive because they may have heard from other maybe friends or other people in support groups or from healthcare professionals that trying to conceive might be a little bit tricky, and they may indeed have problems getting pregnant. And so that can add a little bit of sensitivity and a bit of stress. But this is where, again, as clinicians, by really optimising those dietary conditions before these couples start to conceive, it can really help stimulate fertility and help to significantly reduce problems with fertility. There's a client that springs to mind who had polycystic ovarian syndrome, and obviously PCOS is associated with a more difficult chance of conceiving. She and her husband, or husband-to-be at this stage, really wanted kids. And so they came to see me even before they were married, and she really made a lot of dietary changes, improved her health and her weight and her diet, and they actually started trying to conceive straight after their wedding and conceived straight away. So they had their baby very, very quickly. But you know, that was a blessing in the end. Better too fast than having years of problems. Our next stage is that of assisted reproductive treatment. So that's things like ovulation induction, where you actually use medications or hormones to help induce ovulation for women who aren't ovulating regularly, or also things like IUIs or artificial insemination. And that's often used for couples who may have some type of mechanical difficulty conceiving. So often it might be that the man isn't getting erections, or maybe he's had cancer and he has to have his sperm frozen or something along those lines. So couples with ART can often be feeling, though, a bit startled because they see that all of their other friends got pregnant really easily, and now they're starting to realise that they're having problems. And so they start asking all of these questions about why. But again, nutrition can often make a very big difference for couples who are undergoing ART. And there's a lot of things, if we think about that slide that we just went through before, all of the different places where nutrition can have an impact. So nutrition can often solve the problem. Like once you know the area, the area where the fertility problems are, then we can modify the dietary recommendations to suit that particular condition. And then finally, we have couples who are undergoing IVF, or in vitro fertilisation. And so couples who are undergoing IVF are typically feeling quite stressed They're starting to ask all those questions about whether or not they're actually going to be able to get pregnant at all. And it can be quite expensive and quite an emotional roller coaster. But here, nutrition can make another big impact in that there's a lot of research showing that nutrition can actually create stronger outcomes when it comes to IVF. So now, like I said, let's look at each of those a little bit more closely, and with the lens of either the extra virgin olive oil or the Mediterranean diet, and just have a bit of a look at what the research is telling us on how it might make a difference. So first of all, we've got our couples who are trying to conceive. And like we said, nutrition can shape their baby's future. And I just think this is such an important message to be getting out. Healthcare professionals often know it, but it's often not that common knowledge in the general population. And I don't know whether or not you've heard of this term, the first 1,000 days, which is becoming more and more common now. Basically, the first 1,000 days, and there is a bit of debate about when exactly it starts and finishes, but it certainly includes that preconception period and then goes throughout pregnancy and then into infancy. So around about a period of around about 1,000 days. And the reason why this first 1,000 days is so incredibly important is that the research suggests that this is when the majority of the genetic programming for the infant is undertaken. And so this really helps to set up and influence things like the child's future weight. So obviously things like the baby's appetite hormones and how easily they're going to be able to store fat and all of those things that then help to program the baby's future weight. And therefore their risk of chronic diseases. It also has an impact on their cognitive development and abilities. Also, like another one is their taste preferences. So the baby's taste buds are actually starting to be developed at about 5 months of gestation. So this period of the first 1,000 days is essential when it comes to that programming, that epigenetic programming for baby's future health. And it's exciting because as clinicians, we're often working with people trying to help to undo previous damage, but this is true nutrition prevention. Now, in terms of where Mediterranean diet and monounsaturated fats in particular come in here, is that there have been a couple of studies about women during pregnancy that when they consume more of a Mediterranean style diet, that has been actually linked to decrease cardiovascular disease risk for the baby later in life. So for example, there was a study done by Dr. Chatsi and colleagues, and what they did, they compared two groups. One was, they had 997 mother-child pairs. So one was a group from the US and another was a group from Crete in Greece. And then they looked at a whole range of different factors like skin fold thickness and waist circumference and CRP levels and blood pressure, for example. And essentially what they found was that greater adherence to the Mediterranean diet during pregnancy really may help protect against offspring cardiometabolic risk. And so we've seen that in a few studies now, particularly when we're talking about Mediterranean diet during pregnancy. So it's exciting to think really, isn't it, that what a mum eats during pregnancy can have an impact on the next generation. Another trend that I've really seen throughout the research is that what a woman eats in that lead up to conception is what she's likely to eat during pregnancy. And what she eats during pregnancy is what she's likely to eat when she has her little one. So I often say I would love to see a Medicare, some type of Medicare number allocated towards consultations for dietary advice, like for couples who are trying to conceive or during pregnancy, just because it's such an important time and has such a big impact. Now, I better move on. So our second layer of our pyramid is those who are undergoing dietary conditions. And so like we said, that's things like polycystic ovarian syndrome and endometriosis and IBD, insulin resistance, thyroid conditions, etc., etc. Now, we know that some of these conditions, particularly the endometriosis and polycystic ovarian syndrome, can be improved with extra virgin olive oil and a more Mediterranean style diet. So first of all, looking at endometriosis. So now I don't quite know how to pronounce this name, but I think it's Dr. Aparicio Soto. They found, and his colleagues found, that extra virgin olive oil was beneficial for a range of different inflammatory diseases, such as rheumatoid arthritis and IBD. And so again, it makes sense that that extra virgin olive oil, given what we know around its anti-inflammatory properties, that it will be very beneficial for endometriosis. And endometriosis tends to have a significant impact on fertility. It's one of the main conditions that I see from clients who are struggling with their fertility. Now, for those of you who don't know what endometriosis is, it is an inflammatory condition, and it's basically where uterine tissue grows outside of the uterus, and that can cause both pelvic pain and can also cause blockages. So particularly if it's somewhere like the fallopian tubes or something along those lines. So at the moment, even to diagnose it is difficult. So it's often diagnosed through a laparoscopy, and that's usually the treatment as well. It's often a surgical treatment. But there is more and more research coming out just over probably the last decade showing that, yet again, that nutrition has a very big impact on endometriosis. So this is a really important area for clinicians to be getting involved in. Now, the other area that I think is really important is in terms of polycystic ovarian syndrome. So again, when we're talking about PCOS, the stats, this is again probably one of the most common areas that we see people struggling with fertility. So with PCOS, that tends to impact upon insulin resistance, or some might be the other way around. It may be that insulin resistance causes the polycystic ovarian syndrome. There's still a lot of confusion around that, which it is, the chicken or the egg. And so, but what we do know is that by helping to improve that insulin resistance as much as possible, that can often help with menstrual regularity and therefore ovulation regularity as well. And so in terms of a Mediterranean style diet, what we're looking at there is that a Mediterranean style diet tends to be very low glycemic index, which is great for the insulin resistance. It's often very high in fruits and vegetables, so fantastic from an inflammatory viewpoint. And then again, the extra virgin olive oil, of course, having that really anti-inflammatory benefits as well. Now, I also then want to show you this study, which is quite old, but it's such a pivotal study. So this was done by Dr. Shavaro and colleagues, and what they found, I'm not sure if you can see my little pointer here, but it was a cohort of over 1,700 women, and what they found was that a combination of 5 or more lifestyle factor changes, including diet, weight, and physical activity, was associated with a 69% lower risk of ovulatory disorder, infertility. So it's significant results, and it's a study that is often talked about And there's actually been a lot of little mini studies done as a result of this first study. Now, when we have a look at some of the dietary patterns that they found, one of the first that they found was a diet rich in monounsaturated fat and low in trans fat. We'll also see increasing plant protein intake, low glycemic index, and then again higher intake of iron, especially from plant-based sources. So again, we see that this is very much of a Mediterranean style diet. And of course, our extra virgin olive oil is very rich in monounsaturated fat. So we can see here the benefits there of a more Mediterranean style diet, particularly for those couples who are having problems ovulating. Okay, so our next group then is those who are undergoing assisted reproductive treatments. So here I'd like to talk just a little bit about the sperm. So we have to remember, as much as a lot of fertility, both treatments and education and so forth, tends to be directed towards women, this is starting to change, which is fantastic. So we need to remember that 30% of fertility problems are the result of the women. 30% are actually the result of male problems. 30% are as a result of combined, both men and women. And then we also have about 10% that are unknown what is actually causing the infertility. So when we talk about men's semen, there is some studies to suggest that EVO may actually help to improve semen quality and also sperm functionality. So again, when a fertility specialist is looking at sperm, you're looking again at the number. So you want a good sperm count. You're wanting to make sure that they are healthy and swimming well and that they have the right type of shape. And so we can see here that extra virgin olive oil can have a few real benefits there. Now, there's two main factors in our EVO that seems to have an impact both on egg health and also on our sperm health. The first is because of all of these monounsaturated fats, that seems to really help to reduce inflammation. And so it's that reduction in inflammation that seems to make a difference there. And then the second part is that extra virgin olive oil is very rich in vitamin E. Now, vitamin E is obviously a fat-soluble vitamin, and it's, as well as being a vitamin, it's also an antioxidant. And one of its main roles is to protect against cell damage. And again, remembering that a sperm and an egg are essentially cells. And so the belief is that that's why studies seem to be showing that vitamin E makes such a difference when it comes to sperm health and also egg health. So there are studies around actually supplementing men's and women's diets with vitamin E supplements when they're trying to conceive. And there are also studies directly using extra virgin olive oil. Now, the thing that you have to be careful with if you are using actual vitamin E supplements in that lead up to fertility is that being a fat-soluble vitamin does stay in the bloodstream and can cause toxicity. And during pregnancy, vitamin E is actually linked to low for gestational weight babies. So we don't want to be putting people on high doses of vitamin E long term. And that's where, again, I think that extra virgin olive oil has some real advantages. Sometimes I do use supplements, we'll see in a minute, where there's another benefit. So sometimes I do use them short term, but I think that using the EVO is a great choice. So the next thing that we want to be doing when it comes to couples who are undergoing ART, so we've looked at the sperm, and so say we've got really healthy sperm. The next thing that we want to be doing is having a look at the eggs and making sure that we've got healthy eggs and also the fluid surrounding the egg. And so the stats seem to suggest that about one of the most common problems with fertility is this inflammation surrounding the eggs. And that really impacts upon egg quality and therefore decreases the chance of conception. Now, the more overweight a woman is, the more likely she is to have this inflammation, is what we currently know. It can also cause what they call disorganized DNA. So particularly within the mitochondria of the cell, of the egg, you can actually see it looking really disorganized. And women who have this disorganized DNA can find it really difficult to conceive as well. So again, by reducing inflammation, and there is often quite a parallel. So if you're looking at a woman's lipid levels, like their CRP and triglycerides and so forth, there's often a parallel between that and the inflammation. Triglycerides and so forth, there's often a parallel between that and the inflammation surrounding their eggs. And so, like we would do with any other client, helping to reduce inflammation seems to have a very big impact upon improving egg health and improving ovulation. And so, obviously, how do we decrease inflammation? Well, one of the big things is increasing intake of monounsaturated fats and also increasing the intake of omega-3 fats and then increasing the intake of our antioxidants. So we were talking about increasing monounsaturated fats, increasing omega-3 and then, of course, increasing antioxidants. So our fruits and veggies for reducing inflammation. And it's amazing how, and then optimizing weight as well. And it's amazing how those dietary changes can have such a big impact in terms of the inflammation surrounding the egg and then menstrual cyclicity and ovulation frequency and therefore conception. Now, obviously, it can take a little while to make these changes. So I often find it tricky when somebody comes to see me and they're saying, "Oh, well, I've got a couple of weeks to get pregnant." These are changes that we really need to be starting earlier rather than later. And so this is where, again, I think it's really important for us all to be advocating about what a difference nutrition makes in this lead up to fertility, to try to help get these messages out there to people. Now, the next part where it makes a difference is we talked before about the importance of implantation. And so to be able to implant that embryo into the uterus, there's a few key things we need. Before I go into those, what I do want to mention is that 50% of embryo implantations tend to result in a failed pregnancy, is the current stat. So this is talking more about, this is stats from ART studies, but we can see what a big difference that makes, and so why having a healthy uterus is so very important. And it's interesting, when I'm seeing clients, it's really important to get their background. So, are they somebody who's just coming at that trying to conceive stage, or are they coming and they're having a donor egg? So often I'll find that clients think, oh, well, I've got having a donor egg and maybe even donor sperm, so therefore I don't really need to worry about my nutrition. Well, this isn't the case at all when we look at what an impact nutrition makes for implantation. So first of all, for implantation is that we need a nice thick uterine lining of at least 7 millimeters. And this is actually one of the most common questions I'm asked these days is, how do I thicken my uterine lining? And so if anybody is looking for PhD topic ideas, I'd really encourage this as a topic, because I think there's a lot more research that could be done in this area, and it's such a common question. So at the moment, there's good research about increasing whole grains for improving uterine lining. There's also studies on antioxidants, again, the vitamin E and also ALA. And then there's also good research on omega-3 fats. So the key things here, again, tend to be really around reducing that inflammation. And it's interesting to note that some doctors will actually put their clients on aspirin to help reduce inflammation, to be able to help implantation. And actually another common question that I often get asked is that there's an old wives' tale that says that eating pineapple core, that you should eat pineapple core to optimize implantation. And I don't know why that old wives' tale came about, that myth came about, but in some ways it does make a little bit of sense, because the bromine in pineapple core is actually an enzyme that helps to decrease implantation and assist with blood flow. So again, there hasn't been any studies on it to show one way or another, but it does make some sense. So again, when we're thinking about extra virgin olive oil and the components in that, we've got that vitamin E, and we've got those good unsaturated fats, which really help to decrease inflammation, which is really what we want to be doing at this key part of the fertility journey. Oh, and that's what I was just talking about there, actually. So yeah, the vitamin E. So then our fourth stage is those who are undergoing IVF, or in vitro fertilization. So IVF, the difference between ART and IVF is essentially where you're joining the egg and the sperm in a test tube. So IVF literally, in vitro, of course, is in glass. So it's bringing the sperm and the egg together in glass. So again, there's quite a few studies about different foods and how they can have an impact when it comes to IVF. But there's been a few lately that have shown about the Mediterranean diet. So one was by Dr. Vujkovic, and they found that when women were consuming a more Mediterranean-style diet, that they were more likely to become pregnant than those who were consuming what they called a health-conscious diet. So the health-conscious diet tended to be lower in fats in general, and also lower in legumes than the more Mediterranean-style diet. So there seems to be something in this, having the good fats from the Mediterranean diet that was very beneficial to IVF actually getting to the stage of having a live baby. The second study was a study by Dr. Harayunis, and they found that by increasing their Mediterranean diet score by 5 points, they had a 2.7 times higher likelihood of a pregnancy. So again, when we're thinking of those different parts of the fertility journey, I think it's really about the EVO that helps to reduce inflammation that makes such a big difference. And this is just why I think it's such an important time to be looking at people's diet, because when you're about to spend $10,000 or $15,000 on yet another cycle of IVF, to think that you can get such significant improvements by having a more Mediterranean style diet, it shows how worthwhile it is for for us to be getting involved with dietary changes with these clients. So just to summarise, so I really believe that EVO can be beneficial for fertility for both couples who are trying to conceive naturally in terms of the first 1,000 days in epigenetic programming, for couples that have dietary conditions which may impact their fertility, for couples who are undergoing ART, and for couples who are undergoing IVF. And if I can also just say, we have a journal club that goes out to healthcare professionals each week. We send out on a different topic 3 articles. So if anybody is interested in subscribing to that, it's free to subscribe to. My contact details are there. I don't have my email address on there though, but it's just melanie@melaniemcgrice.com.au actually as well for the email address. So feel free to shoot me through an email and we'd love to add you to the list. Or with any of your comments, yeah, feel free to reach out. So happy to take some questions now though.
Thank you so much, Melanie, for that super informative webinar. That was fantastic. So yeah, it's been a bit quiet on the question end, but please, anyone send through any questions that you may have. But I might just kind of kick that off. Melanie, for healthcare professionals, how would you, I guess, encourage your patients, or how can we encourage our patients to include extra virgin olive oil in our diet?
Yeah, great question. Well, I think the first thing is in terms of salads, because, yeah, like people use all sorts of different bought dressings and things these days, and there are some absolutely, well, you know, you guys make some delicious olive oil that you can either have by themselves or mixed maybe with a little bit of garlic and a little bit of lemon juice, and particularly your infused olive oils are beautiful as well over a salad. Even having it at the table with some sourdough bread can be another great example. And also in cooking, I find that's the most common question, or not most common question, but the most common aha to people is I'm still really hearing that myth on a regular basis that you can't cook with olive oil or extra virgin olive oil. And so just really trying to break down that myth and reassuring people, because I love drizzling it over, say, particularly we're heading into winter now, so dripping it over some veggies and roasting them in the oven, something along those lines.
Perfect.
So yeah, definitely with using it as a main source of oil there.
Great. Thanks so much, Melanie. So I've got a few questions coming through now. One of them was, what do you recommend to increase iron?
Well, I find that's another thing that people are often confused about as well, because people feel like they have to be eating large amounts of red meat to get their iron, when in fact a serving, like 100-gram serving of red meat, only has about 3 milligrams of iron in it, which is nowhere near our recommended 18 milligrams a day. So to think of how much red meat we need to eat to meet our iron requirements, we'd be having kilograms worth a day. But iron is actually in a wide range of different foods, everything from bread to our green leafy veggies and crackers and rice and like heaps of different foods. And so it's more about eating enough variety throughout the day to meet your iron requirements. And then I always say to my clients, there's not very much iron in Tim Tams or ice cream though. So it's about having a diet that's really low in highly processed foods and having that really natural type diet to be able to get the iron from. So yeah, I don't think that having a more Mediterranean style diet with less red meat, that causes iron deficiency in many people. It's usually more people who have a more highly processed diet that have problems with iron. And if somebody does have problems with iron, then occasionally they may need some supplementation just to help get them back on track again. But little things like changing from white rice to brown rice, that that doubles, like again, you're talking about 1 milligram to 2 milligram, but still that doubles the amount of iron that you're getting. So all those little changes can make a difference.
Great, thanks Melanie. Another question is, what are your recommendations for fish or seafood intake? Are they different to the current guidelines, as the Mediterranean diet usually has quite a high intake of seafood? What's your comments on that?
Yeah, so I agree. I think fish is fantastic for fertility. We talked a lot in this presentation about the power of reducing inflammation for fertility, and so fish can be really beneficial there too. It's interesting to note a lot of people, particularly when they are pregnant, are so concerned about fish intake. And I would say, like, as much as we need to let people know about the risks in terms of mercury and listeria, the benefits of fish actually outweigh those risks. So FSANZ categorically states in their materials that that tinned fish, so tinned tuna, for example, is quite safe to eat. It has very low levels of mercury. So that is one option. So we were talking earlier about my Nourish with Melanie YouTube channel. I've actually got a video on there about the best type of fish to eat during pregnancy, in terms of being the lowest in mercury, whilst being the highest in omega-3. So that might be something that people might like to check out. And in terms of listeria, people just need to make sure that their fish is well cooked. So another confusion that I often hear is people don't need to worry about listeria when they're trying to conceive, just when they're pregnant. So if somebody is undergoing IVF and they actually know when they're going to conceive, then they're quite safe to eat high-risk listeria foods up until that date. But once they've had the implantation, then they need to go onto a low listeria diet. But for people who are just trying naturally, then obviously they don't know when they're actually going to conceive. For those people, it is worth avoiding listeria right from the start.
Thanks, Melanie. Another question here, is there a daily recommendation for the amount of extra virgin olive oil?
That's a great question. No, I haven't seen any actual recommendation, and I really believe that it varies depending from client to client. So another common cohort of women that I tend to see in my clinic are those with very low levels of body fat. And they often come to see me because they, I think they have often tried to conceive, even with IVF, and really struggle to, because they're just not ovulating, particularly if their levels of body fat are really low. And that might be because they're an athlete, or it might be more their natural body frame, or they might have a previous eating disorder or something along those lines. And so with those clients, I put them on very high amounts of EVO. I think the higher the better, really just trying to get up those levels of body fat. And I actually have had success in the past with having clients where we've been able to increase their levels of body fat, and also their nutritional intake, and helping them to conceive. But it's often helping women to get through that mental barrier of changing their body shape and their physique as well. Even if they are a lower percentage of body fat due to being an athlete or something along those lines, often it can feel quite different for people. So for somebody who maybe is more in an overweight category, having looked at the research, I still think that a more Mediterranean style diet, rather than, again, that health conscious type diet, which is low in fat, seems to be a good idea, particularly in that last 4 to 6 weeks prior to conception. It seems to be that having those extra fats are really beneficial at that stage. And so if for people who need to lose weight, I really believe that they need to try to lose weight earlier and then maintaining weight in that sort of last 6 weeks prior to actually undergoing IVF.
Thanks, Mary. I think that kind of leads well onto this next question, was that, so for someone with a thick lining, would you discourage the intake of extra virgin olive oil or any other foods?
No, I don't think that they need to cut it out. But yeah, I'm just trying to think through. I have to say, I haven't really had clients complaining about this being a problem. And no, I don't think that you necessarily need to cut it out. I might, if it's okay, you said you're going to send out some answers later. I might actually do some research into that and just have a bit of a think about it and get back to that person if that's okay.
Yeah, no problem. Yeah, so that's just, I guess, a good reminder for the audience as well that this session has been recorded and we will collate all these questions and get all the answers from Melanie and send the webinar recording and the answers to you guys hopefully by next week. I guess I just had another question to Melanie. I just heard you mention that you kind of thought about, it'd be a good idea to have a Medicare subsidy for, I guess, allocated directly to people, trying to get pregnant and giving them dietary advice. Is that something that, I guess, is a possibility, and could healthcare professionals, in a way, kind of help achieve that somehow?
What can we all do? I think it's all just about us all mentioning it and lobbying for it. So whenever there's an opportunity, so often, for example, the Dietitians Association of Australia will do submissions when they're doing Medicare reviews and so forth. So those types of times I will always send off a little email saying, oh, could you add this in as well? So the more people who are raising the matter when these opportunities come up, the better, really. So I think it's all just about us. And sometimes, when I get opportunities to speak to the media, again, just mentioning it. So and same thing for you guys, if you're being interviewed by a local newspaper or something and the topic is on pregnancy, again, just calling for Medicare rebates for this really important time, because, as we said, it makes so much of a difference.
Great. Thanks, Melanie, and thanks again for a fabulous webinar. We're just going to quickly pop up for those of you still around, just a quick survey. If you could do that for us, it'll help us kind of, I guess, better our next webinar and hopefully get some ideas of what you guys are looking for in education. So thanks, Melanie.
Thank you so much for having me.